People are actually out there in the garden doing things that perhaps a few months ago they wouldn't be doing. As a result of this, we're seeing increasing in hand injuries, and it's many-fold. People are at home now, so when they're at home, they're doing, for example, more cooking. They're in the kitchen. Children around are in the kitchen as well. So, for example, you can have knife accidents, burns, and scalds, not only to the person who's actually doing the cooking, but, for example, the child who's inquisitive and is looking around for things to do. We're also seeing more, for example, table saw injuries, those projects that people have had that they put off, I'll get to it one day. Well, now they're getting to it. And, the other day I was at a home hardware store, and it was packed, and people are buying table saws and drills. And even if you're not accustomed to this, or if you're used to doing this, you're still subjecting your risk for these types of injuries. In addition, we're seeing increasing in gunshot injuries. It may be that the parents are used to having the gun at home and not having their children around. They may leave it out by accident, and children are inquisitive, and we're seeing gunshot injuries as well, especially in younger patients. The hand is an intricate organ, and as you can see, it has many functions. And the issue there is when you have a hand injury, not only do you injure the skin, but we worry about critical structures such as nerves and blood vessels and the bones and tendons. And they all work in a perfect orchestra. And when they're injured, it can lead to devastating injuries, not only in terms of the surgery, but also the recovery. You're looking at months and months of hand therapy. And the goal is to get you as normal function as possible, but sometimes that isn't the case. And especially as we're trying now as physicians to decrease patients coming into the hospital, because we want to protect our patients. We want to keep them at home, as the governor has said. And when they come into the hospital, they may be subjecting themselves to increased risk with the coronavirus. So we want to keep our patients out of the hospital, but by them doing these activities, they are subjecting themselves to these risks. The main thing that we want to get across is we want to protect our patients. And if a patient does have an injury to their hand and they need to see a physician, it means coming into the hospital. And that may be either in the clinic or the emergency room. And now don't forget, you can just see the media every day how our emergency rooms are packed with patients who are sick with this coronavirus. So it may be that a patient comes in who doesn't have any signs or symptoms or any contact with coronavirus. Now they're subjecting themselves to that increased risk. That's number one. Number two, we also worry about their care that they have afterwards. They need dedicated hand therapy. They need several visits to see the doctor. And this all increases their exposure to this. And so that's why we really want to sort of get the message to our patients in terms of think what you're doing. Am I doing anything that's putting me at extra risk, my family at extra risk, and also the healthcare providers that are taking care of me? Remember, when you see a healthcare provider who's taking care of you, it potentially can take away from a patient who may have the coronavirus who needs their care as well.